Happy Friday, everyone. So my headline today is from FIU News by Angela Nicoletti. CBD good for HIV-infected brain cells? A new Florida International University study shows CBD works at the molecular level to reduce HIV-associated neuroinflammation, keeping infected cells under control so that they don't activate and spread the virus. Over the past decades, drug advancements have improved the care of HIV-infected individuals. Combination anti-retroviral therapies have contributed to a dramatic decline in the rate of deaths from AIDS. When using these treatments, people with HIV have nearly normal life expectancies. Although the virus can be controlled with treatment, it isn't eliminated. It still wreaks havoc on the brain. Anti-retroviral treatments do not usually cross the blood-brain barrier, which allows the virus to hide in brain cells. The HIV virus enters the brain during the early stages of infection and stays dormant. The brain essentially acts as a repository. Later, the virus may reactivate, causing brain inflammation. The condition is called HIV-associated neurocognitive disorder, or HAND. People with HAND may have symptoms of cognitive impairment, including difficulties with attention, concentration, memory, motivation, and depression. Cannabis users with HIV usually consume 2 to 3 times more cannabis than the general population. Anywhere from 56 to 90% of cannabis users find it helps with nausea, pain, sleep, anxiety, or depression. In a study published in Scientific Reports, FIU scientists tested CBD, THC, and 1-to-1 THC to CBD on brain cells in the laboratory. CBD was clearly the stronger anti-inflammatory. The scientists also found that CBD suppressed the reactivation of HIV-infected brain cells. Although THC was not as potent an anti-inflammatory, it did not reactivate the HIV-infected cells, and in some cases helped reduce inflammation. The active ingredients were applied directly to cells in the lab. Dosages were at 10 to 100 times higher than blood level concentrations after smoking a joint. Although this is great news, it is preliminary evidence that cannabinoids may be helpful in treating HAND. Any attempts to treat with cannabis would be experimental. Ingesting high-dose cannabis oil extracts may be more practical than trying to smoke 100 joints. Clinical trials are needed to better understand the dosage, safety, and efficacy of cannabis treatment. Kudos to the FIU scientists for discovering another potential therapeutic indication for cannabis use. I thought it was interesting how the article highlighted CBD. In reading the study, the results indicated that the combination of CBD and THC may have some synergistic effect and also be useful. Of note, these scientists were studying the impact of drug abuse on HIV-infected cells when they made the discovery. They considered getting high from THC an adverse event, which may be why they only highlighted CBD as treatment. Either way, I think it's good news for people with HAND. What are your thoughts? This is Dr. Jean Talleyrand with High at 9 News.
I agree with you all the way, Dr. T. This is fantastic news, and I do imagine that they probably are mainly trying to promote CBD in regards with this study and leave the THC out, but this reality is the entourage effect is going on, and that is the real, true hero of the story.
Yeah. That was
yeah. The U.S. government are the people who proved the neuroprotective properties of CBD and that it reduces neuroinflammation. So this is, widely understood, paid for by your tax dollars, and patented by the U.S. government.
Yes.
Yeah, I wish Nicole Buffon was on to comment.
Funny
story.
You say that. She's the one that actually sourced this story originally. And then I sent it over to Dr. T because I felt like he would be the most appropriate to cover it from all of his history in the medical field and with HIV patients in the San Francisco area, because this is that's where this whole movement started, and that's how we even have medical cannabis in the first place.
Yeah, absolutely. And we could possibly look at all those folks with HIV who are using cannabis to see if their incidence of hand is lower than those who aren't. I mean, it's an interesting next move for this idea.
I would have to agree with that hypothesis, Dr. T, because from my personal experience of being with all different types of different HIV and AIDS patients over the years and watching their different consumption levels and how they react, I would say that I have enough anecdotal evidence to come to a conclusion.
I would only add that the caution would be, if there's any drug interactions between the CBD and any pharmaceuticals that their physicians are directing them to take, because in a lot of cases CBD impacts the metabolism of these drugs in the liver, and we don't really know, right, Dr. T? Like, I don't know do your patients ask you about drug interactions when they're taking drugs, and whether or not they should be concerned about taking like CBD supplementation?
It's a great question, Mark. But most interactions, CBD or THC may block the metabolism or slow the metabolism of other drugs, and what that does is it makes the concentration of that drug generally higher in the patient. We always titrate our drugs anyway. I mean, there are suggested starting amounts, but if the people are getting adverse effects, or then we'll lower the dosage, particularly with important drugs like anticoagulants, right? And so we can adjust to that. There are drug interactions all the time, and so we are trained to look for them and adjust the medication appropriately. So, I know people bring it up a lot, but, it's just more about being a better doctor and making sure your patient gets the right dose.
Well, and they're not always bad. Sometimes the drug interactions could be synergistic in a way that makes the drug that they're taking to treat the disease more effective because of these secondary and tertiary interactions with the metabolites and the way that they're distributed in the body. So,
Right. What I did think was important was the dosage that they discussed in this. The dosage that they used in the study were huge, and so would we need to dose at really high levels? Would people need to take, concentrates or RSO, or smoke 100 joints, in order to really get this effect? That's the question.
Dose them, Dr. T. Just dose them.